Endometriosis is often framed as a pelvic condition, but for many people living with it, the experience reaches far beyond the pelvis. Today, we are walking through 5 ways it can affect your nervous system, from how your body processes pain to why fatigue and mood changes feel so overwhelming. These experiences are real and deserve understanding. Let us start with the one that reshapes how pain works in your body. Number 1. Pain amplification through peripheral and central sensitization changes the way the nervous system processes pain in people with endometriosis. At the tissue level, endometriotic lesions can release inflammatory molecules like nerve growth factor and prostaglandins that make nearby pain-sensing nerves more sensitive. This means that even gentle movement or normal uterine activity may trigger pain signals. Over time, these constant pain messages can cause the spinal cord and brain to become more reactive, like turning up the volume knob on pain. This process, called central sensitization, can make pain feel stronger and longer lasting, sometimes even when the original trigger is no longer present. Functional MRI studies have shown that people with endometriosis may have increased activity in brain regions linked to pain processing, such as the insula and anterior cingulate cortex, even during mild pelvic stimulation. For many, this can lead to a sensation of pain that feels out of proportion to what's happening in the body, or pain that seems to take on a life of its own. One person described it as always on, like a speaker stuck on max volume, even on days when the lesions aren't flaring. While some clinicians believe removing lesions may help reverse these changes, research suggests that once the nervous system is sensitized, pain may persist and require a broader, multidisciplinary approach. These nervous system changes are real and measurable, and they help explain why pain in endometriosis can be so persistent and difficult to control. The experience is not imagined or exaggerated. Pain amplification is a recognized part of the condition's impact on the body. In second place, pain that extends beyond the pelvis is a reality for many people living with endometriosis. The nerves that carry pain signals from the uterus, ovaries, and surrounding tissue often travel alongside nerves that serve the lower back, hips, thighs, and even the bladder and bowel. This overlap means that pain originating from endometriotic lesions can be felt in areas far from the pelvis, a phenomenon called viscerosomatic convergence. For some, this translates into persistent low back pain, aching hips, or even sharp discomfort radiating down the legs, especially during menstruation. Studies have found that up to half of people with endometriosis report pain outside the pelvic region, with the lower back and thighs among the most commonly affected sites. Cross-sensitization can also occur, where inflammation from endometriosis irritates nearby nerves like the sciatic or pudendal, sometimes leading to symptoms that mimic nerve entrapment or neuropathy. Advanced imaging, such as magnetic resonance neurography, has helped reveal how these nerve pathways can become sensitized or even directly affected by deep lesions. For some, surgical removal of lesions near these nerves may bring partial relief, but pain can linger if the nervous system has become hypersensitive. Recognizing these patterns is important, not only for diagnosis, but also for validating that pain in the back, hips, or legs is not all in your head. It is often a direct result of how the nervous system processes signals from endometriosis. Understanding this broader pain network can help people feel seen and guide more compassionate, comprehensive care. Number 3. A nervous system on high alert is a reality for many people living with endometriosis. Scientific studies have found that endometriosis can affect the balance between the sympathetic and parasympathetic branches of the autonomic nervous system. For some, this means the body spends more time in a state of fight or flight, even when there is no immediate threat. Heart rate variability, a measure of how well the nervous system can switch between rest and activity, is often lower in people with endometriosis, suggesting increased sympathetic dominance and reduced ability to relax. This heightened state may not always be obvious, but it can show up as a racing heart, shallow breathing, digestive changes, or feeling constantly on edge. Chronic pain can train the brain to treat even mild sensations as warning signals, creating a pattern called hypervigilance. Over time, this can make it harder to tune out pain, fall asleep, or recover from stress. Some people describe waking up in the night with a pounding heart, or noticing that small twinges or cramps lead to a cascade of anxiety and tension. Wearable devices and clinical monitoring have measured these changes, showing that the nervous system may remain activated even during pain-free moments. While these patterns can be distressing, they are a recognized part of the body's response to ongoing pain and inflammation. They are not a sign of weakness or exaggeration. For some, learning about autonomic changes can help explain why symptoms like anxiety, sleep problems, or feeling wired but tired so often accompany endometriosis. Recognizing this connection can be the first step toward self-compassion and more effective support. Coming to the top 3, mood, stress, and emotional well-being are deeply intertwined with endometriosis and its impact on the nervous system. Research has shown that people living with endometriosis can experience higher rates of anxiety and depression compared to those without the condition. These emotional symptoms are not a sign that pain is imagined or exaggerated. Rather, they are often linked to the ongoing burden of chronic pain, unpredictable flare-ups, and the stress of navigating daily life with a complex illness. Chronic inflammation and endometriosis may influence brain chemistry and stress hormones, affecting how the body regulates mood and emotional responses. Neuroimaging studies have identified changes in brain regions that process both pain and emotion, including the prefrontal cortex and amygdala. These findings help explain why persistent pain can sometimes feel inseparable from feelings of sadness, worry, or emotional exhaustion. For some people, the uncertainty of when pain will strike or how symptoms will evolve can lead to a sense of walking on eggshells, making it harder to plan, work, or connect with others. One person described the experience as never knowing when the next explosion will happen, illustrating how emotional distress can follow in the wake of physical symptoms. It is important to recognize that these mood changes are a natural response to living with a chronic, often misunderstood condition, not a personal failing. Supportive care, including mental health resources, can make a meaningful difference. But the first step is understanding that these feelings are real and valid. Acknowledging the emotional side of endometriosis can help reduce stigma and foster a more compassionate approach to care. And finally, in first place, deep fatigue and sleep disruption form a cycle that can affect every part of daily life for people living with endometriosis. Chronic pain, inflammation, and nervous system strain may all contribute to difficulties falling asleep, staying asleep, or waking up feeling unrested. Polysomnography studies have measured reduced slow-wave sleep and increased nighttime awakenings in people with endometriosis, especially during times when pain is more intense. For some, this means tossing and turning for hours or waking up multiple times each night. Over time, poor sleep can add to feelings of exhaustion, making it harder to concentrate, work, or enjoy social activities. Surveys show that more than half of people with endometriosis report moderate to severe fatigue, and many describe a cycle where pain disrupts sleep, and fatigue the next day makes pain feel even worse. This cycle can also lower pain tolerance and affect mood, creating a sense of being stuck in a loop that is hard to break. Fatigue is not just feeling tired. It can be a deep, bone-aching weariness that simple rest does not fix. Economic studies have found that fatigue and sleep problems contribute to missed workdays and lost productivity, adding a hidden burden to the condition. Recognizing the pain, sleep, and fatigue cycle is important for self-compassion and for seeking support. These symptoms are real, measurable, and deserve attention in care plans. Across all 5 impacts, one reality stands out. Endometriosis can shape the entire nervous system, not just the pelvis. This is not imagined. It is a real, complex condition that deserves understanding and validation. Gain clarity on your endometriosis by downloading the Mama Health app and by learning from people who have gone through the same thing as you. Mama Health helps people living with chronic conditions feel heard, understood, and represented. This video is for educational purposes only and is not medical advice. Always speak with a qualified healthcare professional about your symptoms.